was a 6-month project starting in February, ending in July, and there were 3 key outputs. The first one was conducting a comprehensive assessment of the human resource for health set of resources within the country and compiling a national database for resource allocation. The second one was developing a national human resource for health policy that was aligned with the country's priorities and objectives around health system strengthening. And the third priority was strengthening institutional capacity and stakeholder relationship with other ministries and the private sector in order to be able to implement the national HRH policy and continue some of the work we had been able to do post-project. All 3 deliverables were achieved, and the Ministry of Health also has confirmed that the 3 deliverables were achieved. More importantly, for me and for the team of health sector professionals I worked with on island, was being able to create an environment where stakeholders willingly participated and willingly collaborated in stakeholder consultations in developing the national policy and in understanding the need for strengthening HRH, or Human Resource for Health, in the country, and being willing to own the implementation strategy of the project. One of the priorities for the project was to create a national human resource for health database and a workforce planning tool to be able to assess and understand resources available to work in the health sector. We also identified the need to create a workforce planning training and orientation, not only for human resource workers, but also for human resource professionals, but also for senior managers and key line staff within the Ministry of Health and across the public service, so that we're speaking a common language and understanding how to apply the tool. A lot of the tools that have been developed can be applied across government. We've reorganized and repurposed and reallocated key positions within the HR unit at the Ministry of Health. That model can be replicated across government. Health sector councils, who represent health professionals, are engaged with the Ministry of Health. So the private sector is engaged with the Ministry of Health on delivering the priorities that were identified in this project in a collaborative manner and at a national level. And that was not necessarily something identified to be achieved at the onset of the project. If we have the right people with the right skills in the right location at the right time, citizens of St Lucia will have access to primary health care in a way they don't today. Citizens will have access to qualified key human resource or health professionals, and it could impact their quality of life, their health outcomes, and can strengthen the development of the country as a whole. For the project, we had a deliberate knowledge management, knowledge transfer strategy, so that as a CFTC expert, it isn't good enough for me to go to a country and provide advice and guidance. It's more important to leave or embed systems, processes, and knowledge so that the project can continue, or parts of the project can continue after I leave. And I'm very comfortable with how the Ministry of Health has adopted practices and processes and assigned key personnel to carry on systems that we put in place, or ideas that we've put in place, or implementing the national HRH policy and overseeing and evaluating and monitoring its effect and its outcome. To me, there are 3 key lessons learned from the project. The first one is having a corporate champion. The permanent secretary at Health, from the first day I arrived, made herself available and was a strong leader and key champion of the project across ministries. At any point in time that there were challenges or difficulties, she was available, able, and willing to lead and interject where required. I think having a project champion in a senior role is a model to use in future projects. The second lesson learned was involving key staff at the Ministry of Health in this project, in participating in the deliverables of the project and in the outputs of the project, so that it wasn't just me doing all the work. Key staff at the Ministry of Health, subject matter experts, were involved at all points of the project. So when the CFTC consultant leaves, it's just a normal course of doing business. So we have embedded the project and we have embedded the outcomes of the project in persons' responsibilities. And the third lesson learned is having a sense of awareness of the organization in which you work and respecting its values, its diversity, and its culture in order to be able to work well with people and to ensure success of a project. I've enjoyed this project. I've enjoyed the support that I've had with the Commonwealth. I enjoyed my time in St Lucia, working in St Lucia, the people in St Lucia, and I can see how projects like this make a difference in a country, but have the ability to change a person's life, and that's important.